Good morning. On behalf of the NC Chamber, thank you so much for joining today's webinar, Educating Managers on Mental Health. I'm Natasha Simmons with the NC Chamber. All attendees are muted to avoid any distraction during today's presentation. If time permits, we'll answer as many questions as possible at the end of this presentation. If you'd like to submit a question during the meeting, please use the Q&A box. Please do not use the chat box. The recording of today's webinars and the webinar and the slides will be made available to you via email. Within 24 hours of the webinar. In the second installment of our mental health series today, we'll discuss tools for arming managers and supervisors with core skills to help support mental health of their team members. This topic today is a crucial one. Managers have the opportunity to act as a frontline defense for helping their employees during mental health issues, but they must have the tools and resources to do so effectively. That's what we're going to focus on today. The pandemic has without question exacerbated this health crisis in our state and country, which is why we've been dedicated to discussing it in several recent conferences, including our Women's Conference and Healthcare Conference last fall, and most recently, our first mental health webinar a couple weeks ago, creating a mental health friendly culture. Today, though, we're going to take a much deeper dive, but I know we're all eager to hear from our speakers, so let's get started. First, we'll hear from Dr. Narissa Price. Dr. Price is a Wake County native who received her medical degree and completed a child and adolescent psychiatry fellowship at UNC Chapel Hill School of Medicine. She is board certified in general psychiatry. She's devoted her career to improving the health of the mentally ill. Dr. Price brings over 18 years of experience from her work with Price Psychiatry, UNC School of Medicine, Daymark Recovery Services, Correctional Institute for Women with the NC Department of Public Safety, Cardinal Innovations in Community Care of NC, and she currently serves as Medical Director at Wake Med. Dr. Price, thank you for being here, and over to you.
Thank you so much for having me, and thank you for that introduction, Natasha. So today, I hope will be an interesting and helpful conversation about mental wellness and specifically well-being in the workplace. And so discuss really from a broad perspective, if you as an organization would like to build a culture of well-being, how to do that. Next slide. Can you hear me? Okay, great. Thank you. So sometimes a picture is worth 1,000 words. And when I sometimes try to wrap my brain around all that's happened to us in the past several years, this was kind of one of my first iterations or recent iterations of trying to put that all together. So certainly COVID, and then my money up there that people are very much so worried about, focusing on access to gas, for example. I could add another slide that recently of having even baby formula having difficulty. We also have seen the war in Ukraine, and really in a more visual, vivid way of seeing all that has been going on with the folks over in the Ukraine. And then worries that honestly I hadn't had since a child about the potential of nuclear war seem to be coming up more. And of course, there have been the ongoing issues that many of us have experienced with concerns regarding social justice in the country, and then also climate change. So there's a lot that people everywhere have been worried about. Next slide. And so on the good side, that really, okay, it seems like you all are having some difficulty hearing me. So let us try that. Let's try turning off. I promise I won't change much in my appearance. So let me know if that's any better. So on the good side, we've seen that our COVID infection rates have slowly declined. However, on the opposite side, and yet related, is that we've unfortunately seen our rates of depression, anxiety skyrocket. Next slide. In fact, we've seen, for example, at the height of the pandemic, somewhere around 40% of US adults reported struggling with a mental health or substance use issues. So just to kind of give you just a frame of reference, that typically or pre-pandemic, our rates of depression or anxiety were in single digits. And now these rates have quadrupled. And so a mental health system, which already, particularly in North Carolina, was already stretched prior to the pandemic, has really been overwhelmed by the demand and the need for more mental health resources. Next slide. So not only have we seen that anxiety, depression, other mental health concerns escalate over the pandemic, but we've also seen burnout also seeming to worsen. So first off, what is burnout? Burnout is a work-related stress syndrome resulting from chronic exposure to job stress. So, think about burnout as a potential outcome, just with the day-to-day stressors that people may have that then cause injury and those injuries are not repaired in some ways, then it could result in burnout. And so there are three elements to the syndrome of burnout. There's emotional exhaustion. And so this is where, emotionally, you just feel like, what's the point? That you just have no energy. And this is a pretty big difference, perhaps, from when you first started working at your particular job or in your career, where you had lots of enthusiasm and hope. This is the exact opposite. If we add to the emotional exhaustion, depersonalization, which is where we have a detachment really from the human side of things. So for example, customers or clients no longer are really, their name and what we know about them, their family, what their hopes and dreams are from our services, and they become just a number. We can also have that depersonalization with our coworkers as well, that we no longer really make that connection of the individual person. And then finally, if we add to that, having decreased professional efficacy. And so this is where you feel like the hamster on the wheel, that you are working as hard as you can, but you're not making much progress day in and day out. If you have all three of those symptoms, that is burnout. And that is also what we have seen as have increased over the pandemic. Next slide. So why are we even interested in having this discussion? Especially, this is an NC Chamber meeting. Why are we talking about well-being in the workplace? Next slide. Well, the reason why is because there's really a good business case. So, in addition to it maybe being a nice thing or even the right thing to do, there's actually a business case for looking at well-being, supporting our employees' well-being. There's pretty much no industry that hasn't been touched in some way by the Great Resignation. Sometime last year, around 4 million people quit their jobs each month. And some of those folks, if you ask them, they might have said, hey, greater opportunity. And so they found that changing jobs might mean an increase in salary. Some of those folks may have planned already to have a retirement, and this just felt like the right time. But when you ask a lot of these people what they were looking for, it's better work-life balance, better well-being. And so if we address that, then maybe we may impact some of that, that major loss that we've had in our workforce. And so there's been a lot more interest and focus on recruitment and retention, but those efforts often they cost, and there are direct and indirect costs for replacing staff. So direct costs, for example, if you have to go up on the salary to recruit the next individual, and then all the advertising that may go into finding the correct individual, but they're indirect costs, particularly to the team that's left behind, that's short-staffed. And now they have more, for example, burnout risk because there is a great workload, or how that might affect their morale. And there are other direct and indirect costs I'm not even mentioning here, but somewhere they estimate that there's between 1.5 to 2 times the cost of an employee's salary is what you end up paying when you lose staff. And so again, it starts to add up why well-being is a smart decision to really focus on that. Next slide. And the truth is that not all companies have fared as poorly, even when it comes to the Great Resignation. And so I looked at this recent announcement, the 2022 Fortune 100 Best Companies to Work For. This is what they say in the first sentence I want to read to you is the 100 best adapted to massive changes in the workplace by prioritizing employee well-being. That's the first thing: inclusion, purpose, listening, and care wherever their employees are, both in and outside the office, to defy the Great Resignation. So this is actually not just me saying this will work, but it's actually panned out from a number of the top companies that if you focus on employee well-being, then you do much better at recruitment and retention. Next slide. So you're now hooked, you're interested, you're ready, I've sold you. You want to do something about building a well-being culture. So how do you do that? Next slide. So I used this slide. It was originally developed by the military, and it was a way of conceptualizing where people might be within an organization, a team, or a group, from a well-being perspective. So green is, this is good. This is, people are mission ready in this category. They are able to focus, get the job done. Then there's the yellow category. So this is where they're having some mild impairment or difficulty. Usually it's transient. They might show signs like some irritability, or maybe they're having more difficulty sleeping. Any type of stress potentially could cause this. But for the most part, these are folks who are functioning, they're able to do their job, but you might see a little cracks on the surface. And then we have our orange category. So this is where you've had much more sustained injury. This person might feel loss of control even. They have maybe excessive guilt or shame. So even they know that something is going on, they don't feel their natural selves. They also may not be willing to talk about it. And so this sort of thing is what we see, for example, with life, where a person has had a loss, or when their life has been threatened, i.e. like a pandemic, and just also the excessive wear and tear of certain jobs. And so this is where burnout, for example, might reside. But then we also have the red category, which is where a person has a much more disabling dysfunction, and they likely have a diagnosable mental illness. And the reason why this is important to kind of have this idea in your mind when you're talking about building a program is that you want to have well-being resources for each of these groups, because I guarantee you each of these groups are in your organization, whether or not you know this or not. Next slide. And so what are some of the things specifically or have paid for a lunch for the entire team. Those are well-being strategies. But what you might if you look at your inventory, you might see that there are gaps, especially if you're thinking about that continuum of care that needs to be considered. The second thing you want to do is you want to measure your well-being and track it. So there are a number of different well-being tools. Some are free online. The toolkit that we work to put together with the North Carolina Chamber has a link to some of those well-being surveys. And it's important to kind of give you a snapshot view of like, really, how are your employees doing? But then don't just measure it that one time. Keep measuring them, especially after you do some sort of intervention, to see how well it's doing. My third tip would be to make an emergency plan for mental health crisis. So this is kind of your worst case scenario, or in the continuum, your group who may be in red. We have all kinds of emergency plans, like for, if there's a fire or if there's some sort of physical health emergency, but do we have a mental health emergency? And so making a plan for if you have an employee who arrives and who seems to be emotionally distressed, and you're very concerned, have a plan to manage that person ahead of time. And then finally, my tip for you all would be to model balance. That it's one thing when a manager is saying, oh yes, you need to take care of yourselves, take time off. But it's another thing for you to model that work-life balance. That will really give your employees permission to take care of themselves if they can see how you really also follow that and you really mean it when you say take time off. Next slide. And just finally, there are some specific strategies. In fact, there's dozens and dozens, and these are just a few that I have mentioned here that have been connected in research as being very helpful in building cultural wellness. Having flexible scheduling options or even more part-time options. The pandemic did disproportionately impact women, for example, who are often still more responsible for childcare. So giving those type of employees more options may keep them in the workforce. Developing a well-being calendar of events. Like I said, you're probably already doing some of these things, but if you have them mapped out, and so employees have something to look forward to, and they also can see that this is important to you in a way that they know that is true and genuine. Bring in speakers to discuss about various well-being topics. So maybe you bring in folks who are expert on stress management or financial planning, all aspects that really might help improve well-being. Adding a well-being discussion item to regular scheduled meetings. So you don't have to have like a totally different program for well-being. It can be incorporated into your business as usual. Maybe just add it as an agenda item that you talk about some well-being topics, maybe 5 or 10 minutes worth, but this shows your employees that you're really invested in well-being. Consider assigning a well-being officer. So in healthcare organizations, those officers are called chief wellness officers. And what that does, it kind of assigns for a person in your organization that's really one of their focuses, that they're going to keep their eye on well-being in particular. And I wouldn't say that this person works alone by any means. No, I think the task of changing culture really involves everyone on the team, but this really kind of focuses in a bit more. And then finally, considering, if you haven't already, having on-site well-being resources, such as having a mental health counselor or having childcare options or massage therapist or financial advisor, just as an example, because again, people will see in every day how you value them, and it will send home the message that you care about them, just more than just a number or a cog in the wheel, but a person. And that's my talk.
Awesome. Thank you so much, Dr. Price, for that. Let's see, we're going to go on to Ruby now. Now we're going to hear from our final, or excuse me, I'm all over the place right now. Now we're going to hear from Ruby Brown Herring. She's been with us at our conferences before, and we just love having her here. Ruby is the president and principal consultant of RBH Wellness Solutions, where she assists organizations with creating employee well-being strategies that support mental health at work while improving belonging, engagement, and retention. Ruby holds a Bachelor of Social Work from UNC Wilmington and a Master of Education in Student and Personnel Services from the University of South Carolina. She has over 20 years of experience in program management, adult continuing and higher education. She's a collaborative leader, always looking to connect with organizations that need a subject matter expert on wellness to step in and build the foundation for a healthier workforce. She's also recognized as a state and national leader in corporate wellness and community mental health education. Ruby lives in Raleigh with her husband and is the mother of college-age twin daughters, both of whom have lived experiences with mental health challenges. Ruby, over to you. Thank you for being here.
Thank you for having me, Natasha. And so I'm going to kind of pick up where Dr. Price left off, and just, I want to start with this particular slide, which I think summarizes what she just talked about really well. And it's, the first premise is that good health is good business, right? And so we know that when we're thinking about the health and wellness of your employees, mental health should be included in that. Mental health, to the point that Dr. Price just made and some of the information that you'll see me cover in just a moment, it does impact your employees' ability to be engaged, to be productive, which then impacts your bottom line as an organization. And so that's where the good business sense comes in. If we're trying to ensure that the bottom line of the organization is strong, it makes good sense and good business to take care of your employees from the holistic perspective. When we don't address mental health in the workplace, when we as managers don't support our staff with their needs, whether it's through policies and the initiatives that Dr. Price mentioned, or if it's through connecting them to your employee assistance programs, if we don't do that, it impacts our team functioning. And so when we think about high performance teams, they rely on that inclusion, the respect, and that communication piece. Next slide, please. So when we think about some of the common signs and symptoms of mental health challenges, they come in 4 buckets. And if you'll advance to that next item. And those 4 buckets are behaviors, appearance, emotions, thoughts. And so when we think about those 4 areas, right, when we think about what they look like in the workplace, you'll get a better understanding of, how this shows up in the workplace and how you as a manager can recognize some of these potential signs and symptoms that oftentimes are misunderstood. So if you go ahead and click on go ahead and click through the next 4 options and get them up at once, that'll be fine. And so I'm just going to highlight each of these categories here instead of going into great detail, because you'll have the slides afterwards. But when we look at behaviors, it's really about, what is that emerging pattern that we're noticing? Are they showing up late for work or meetings? Are they canceling professional commitments? Are they missing deadlines? Other behaviors that we may notice or they may talk about are difficulty concentration, loss of motivation. And so really paying attention to those behavior changes and patterns that you're noticing. And instead of approaching them from a disciplinary perspective initially, asking more questions in terms of what's going on. How can I support you? I've noticed this change in you. When we think about appearance, are they looking more tired? Oftentimes we may see changes in the way that an individual dresses. They may start to look more unkempt than usual for them as an individual. So paying attention. Oftentimes in the workplace, we're so caught up in the work and getting the work done that we forget to pay attention to our employees. And so just taking a moment to step back and pay attention to them as individuals. When we look at emotions, it's some of the most common emotions that we notice: the irritability, the anger, the agitation, right? It also could be that they're no longer enjoying their work. And that's something that we've seen over the last couple of years as more and more folks have resigned their positions. It's part of it is because they're not enjoying their work. Are we noticing that folks are worried more than usual? Is it impacting their ability to do their work? Are we seeing that they're more frustrated and irritable with their teammates? Are we noticing that there are periods of low self-esteem, or are they oversensitive to criticism that may be coming from you as their manager? So again, paying attention to those changes, those trends in behaviors and emotions. When we think about thoughts, oftentimes that shows up as difficulty concentrating or difficulty focusing while at work. You may also see it showing up as confusion or a lot of indecisiveness. So as you're thinking about projects that are happening, are we seeing some indecisiveness on how to move the work forward? Are we seeing that they are self-blaming, they're self-criticizing because something within a particular project didn't go as expected? Are we seeing them worrying about all aspects of their lives? And so one of the things that I think is important for us as managers to understand is gone are the days of saying, leave home at the door. It's showing up in the workplace. And so as managers, while it's not our responsibility to fix our employees' issues, it is our responsibility to support them and ask questions and how we can help move the work forward. Next slide, please. And so if we don't intervene early, and so one of the things that I talk about with my clients is, as we're having these conversations, as we're increasing our noticing skills, what happens if we don't do that? And so without early intervention, these are 6 areas that we could see happen. Long-term functioning is going to be greatly reduced. Right? And so that means that you have folks in many cases showing up at work, but they're not being productive. And that's called presenteeism. So they're there, they're sitting in that seat, but they're not well enough to move the work forward. And so we see that functioning, long-term functioning impacted. We see that disruption in education and employment. So again, if we're not having conversations with team members that we notice some of these signs and symptoms in, it impacts the rest of the team and therefore the rest of the institution, the organization. And so think about, again, why it's important that you're in this session today, because the more that you know in terms of signs and symptoms, the impact that it has overall on your employees and organization, the better the likelihood is that you're going to reduce some of this impact. The strain in relationships in the workplace, but also at home, right? And so because we are whole individuals, because we have 8 dimensions of well-being that make us who we are, if something is happening at home and I'm stressed at home, it's going to show up in the workplace. And so understanding, that this is what's happening and how can you be more confident in having conversations with employees about what they may be experiencing. We see, again, the loss of self-confidence and self-esteem. We see an increased risk for depression and suicide, as well as an increased use of alcohol and drugs. I had a client a few months ago, probably 6 months ago, that we were doing some work along employee well-being. And one of the things that they shared with me that they had not thought about being an issue prior to COVID was that they had an employee who showed up to a couple of staff meetings virtually intoxicated. And so sitting back and thinking, oh my goodness, I don't think my folks would do that. It's happening. And so that's why it's important that we're having conversations like these today to understand those signs and symptoms to look for, so that when you notice those behavior changes, you can intervene early. Next slide, please. And so I want to talk about, some tips for supporting employees. I think Dr. Price did a really good job looking at some of those overarching organizational level tips that you can implement to support employees. But I also want to kind of take a deeper dive into some of those takeaways for you as managers. And so if you'll go ahead and click next, please. And so when we look at these, I'm not going to go into great detail about each of them, but just a couple that I want to highlight. When we talk about being vulnerable, that really goes back to Dr. Price's comment around modeling, right? So be vulnerable, lead by examples. So when we as managers prioritize our own self-care and our own mental health, it encourages others to do the same. So if you're saying to your folks, don't email me out, don't send emails after hours, don't send emails on weekends, but you're doing that, they're going to feel the pressure and the need to do the same. And so be careful and mindful of how you model wellness and well-being to your employees. in fact, by being vulnerable, by leading by example, it does allow and improve trust, right? It allows trust to build, and it cultivates that trust. It improves employee engagement and their performance. More often than not, when we think about managers, and we're oftentimes so focused on the work that we've done, we forget to take care of ourselves. And so I absolutely agree with what Dr. Price said earlier. Taking care of yourself as well is equally important, because again, they're seeing you model the things that you want them to do. And so it's absolutely okay to share with the team member, I'm taking a walk in the middle of the day, or I'm prioritizing a staycation where I'm turning my email off and I'm not going to be available. Because again, if they see that, it's one thing to have policies and say, oh yes, we as an organization value well-being. But if leaders, if managers are not modeling that, then employees are not going to follow suit. When we think about company culture, really evaluating that company culture, checking in with your team on a regular basis, not necessarily to micromanage, but to build that culture of connection. Show empathy and compassion. And so one of the things that we've heard a lot over the last 2 years is give ourselves grace. And we absolutely should, but I've kind of adjusted that to say, because oftentimes when people say, oh, just give me grace or give ourselves grace, it's an excuse for not doing certain things. And granted, there may be situations where that's needed. So now I've kind of tweaked it to say, give them grace and have a plan, because the work has to move forward, right? And so understanding that, yes, Ruby may have troubles in giving her grace, but then having that moment where you then pause and think, okay, how can we move the work forward? And then help brainstorm ways that you can still move the work forward. It may mean that you're bringing other people in to help with that particular project. So give themselves grace, give them grace and so as we talk about encouraging staff to take time off, that's one of the things that we've seen in the data over the last couple of years. People are not taking time off. And so encouraging them to truly take time off, to disconnect, and try to be as flexible as you can in terms of what you're offering. Right? Thinking about how can you model that flexibility? How can you be inclusive? When we think about communication, I put it in caps 3 times for a purpose. It is one of the most difficult things that we as managers do. It's communicate. And so thinking about communication from the perspective of making sure that your team is informed about all of the organizational changes or updates. Clarify if there's any modification in work hours or work norms, and remove stress where possible by setting expectations about workloads. Right? Prioritizing what must be done, and then acknowledging what can slide. And so for folks that are working in hybrid situations, it's absolutely important to have conversations with your team members around what has to be done in the office versus what can be done at home. So if Ruby says, I focus better on Thursday mornings between 9 to 12 at home in my home office, if there's a way to allow that flexibility for Ruby to have that time to focus on a project, grant that. And so just thinking outside of the box for what works for each team member. And yes, that may mean if you're leading teams of 10 to 20 people, you may have 10 to 20 versions of what this looks like. But we all know each person on your team is so individual that it warrants that conversation and that flexibility if possible. If you shared with your team the mental health resources that your organizations provide, share it with them again. I know before I started working completely for myself, I had been at my last organization almost 10 years. There was no way I could have remembered at the end of my time there, my employee assistance resources that I had learned about during my onboarding process. So sharing those resources, making them available to your team, so that they know what they have access to, and encourage them to use them. It's not saying something is wrong. It's simply saying life is hard and we have resources to help you process the things that may be impacting you as a person and impacting you as a team member within our organization. Next slide, please. As we continue to talk, about talking with employees, you can go ahead and put up the next item here. And just a couple of these that I'll highlight. The first one I think is most important. Be aware that their feelings are real. I know there are times where an employee may come to you with a concern and it's your response will be, oh my goodness, here we go again. But their feelings are real. And so validate and acknowledge those feelings and just be present and listen. Thinking about, Dr. Price mentioned the check-in piece. And so asking open-ended questions, but being genuine and respectful. Not checking in and asking those questions because you want to give the illusion that, oh yes, I'm really concerned. Be genuine, because your employees will know if it's coming from a true place of genuine and concern. Sometimes we just have to ask how they're feeling and listen. Not try to fix it, not try to problem solve, but just listen and allow them to share what they may be experiencing. Next slide, please. And you can go ahead and put those up. The first one on this particular slide, I think a lot of us struggle with from time to time, and that's being comfortable with silence. But one of the things that I've learned over the years is that silence is one of the most valuable gifts that we can give an individual. And so if you're having a conversation with one of your employees about challenges that they're experiencing or challenges that you've noticed, changes you've noticed in the workplace, allow them to share and just sit in silence, right? Don't be thinking about how to respond while they're talking. Just sit in that silence, because what it shows them is that you care about hearing their side of the story. You care about hearing what they have to say about the situation. And then finally, be aware of your body language and your facial expressions. Oftentimes we hear this example of being like the duck on the pond, where we see the duck gliding across the water and it's like so effortlessly, but underneath their little feet are paddling away, right? And so be more like the duck on the pond and think about your facial expressions and your body language, because those two things can really put a wall up between you and an employee. So if you've worked hard to build trust where they're comfortable coming to you and having a conversation, if they notice that body language and those facial expressions, they're more likely to be reluctant to talk about any mental health challenges that they are experiencing. And then the final thing here is, parents are the folks that we often hear say to us what we should do, right? And how we should feel. And so I really invite you to think about how you can change your language and be helpful without telling an employee what they should do, how they should feel, what they need to do. Right? And again, listening to them and allowing them to drive that conversation. Next slide, please. And so as we wrap up my time here, the information here is my contact. If there's anything I can do to support you, let me know. But I hope these tips are practical ones that you can find easily to implement in your organization.
Thank you, Ruby, so much. What a great presentation. Now we will hear from our final speaker of the day, Kate Dewberry. Kate is a partner at Poynter Spruill and counsels and represents employees on employment law issues and litigation arising under federal and state laws covering leave, discrimination, termination, affirmative action, and wage and hour law. She serves as employment counsel in mergers and acquisitions, analyzing due diligence and advising on employment components of purchase agreements and transition plans. Kate is also a member of the firm's healthcare section and provides representation and counseling to North Carolina licensees who are applying to, under investigation by, or being charged by a licensing board, and represents parties in hospital medical staff investigations and hearings. Kate, we're so happy to have you. Now over to you.
Thank you very much. I'm excited to be here today. This is a very important topic. It's a very relevant topic. I will tell you, we've seen all the numbers about the increased instances of mental health challenges in the workplace. Just anecdotally, we as a law firm have seen a lot more clients and employers calling us with issues, unfortunately, employees who need time off, employees who are struggling and having performance issues that are directly related to mental health challenges and struggles at the workplace. So I think that this is an incredibly important and relevant topic. I'm going to talk a little bit today about the accommodating employees under the legal framework that exists right now. I think one of the challenges traditionally is that employees and managers didn't know or were concerned what things would look like if they spoke up and what would happen, and how would an employer deal with that. And managers are worried that they'll say the wrong thing and create liability for the company. So I think kind of talking about this framework and really demystifying it can be a really helpful tool in encouraging employees to speak up and get the help they need in the workplace. Next slide, please. So the first thing an employer should do is be proactive instead of reactive. And there are a couple of ways to do this. Now is a really good time to go in and review the policies that you have in place, in particular around your Fmla policy and your ADA accommodation policy. What's really important is that these don't look like just a bunch of legal jargon. I know sometimes attorneys will help draft them, but you should go back in and you should read them with the view of, if I'm an employee and I have a problem, do I know based on this policy what I should do? So you want the policies to be very clear about how an employee can request an accommodation, all the different places they can go. If they're under your ADA policy, you may have forms, but you want to encourage employees that that's not the only way that they can request an accommodation. There's multiple routes, and that way employees know, if I'm not comfortable speaking to my manager, I can go to HR, I can go to another manager, I can go above my manager. Give them options to speak up and request an accommodation. Also, employees typically have concerns about what's going to happen to my medical information if I request an accommodation. What are my coworkers going to think, and what are they going to know? And so it's important that you include in your policy that any medical information submitted in connection with a request for accommodation is going to be kept confidential. The other, as an employer, one of the deterrents we see for employees reporting issues in the workplace or requesting accommodations is this fear of, well, I'm going to be retaliated against, or I'm going to lose my job if I speak up or ask for this. So it's important to have a very clear statement in your policy that the company will not retaliate. Not only is that a great policy to encourage employees to come forward, it's also required under the law. Employers can't retaliate against employees for requesting an accommodation. And then I think that the point that Ruby made was a great one, and I want to reiterate it here. Your policies should really be reissued annually, because if you only do it at onboarding and that's the only time employees see it, they're not going to be aware of the resources and the process. And so if you have a system where you can have employees acknowledge and review the policies annually, that's going to be very helpful. The second thing you can do in creating a culture of support is have what's called an EAP, an employee assistance program. They are usually relatively low cost, and they're all structured kind of differently, but some will provide some free counseling services. Others will connect employees with treatment providers that may be able to help them. But it's a low cost service, and it's a really good way to show support for your employees and that you prioritize mental health. The third thing that is important for creating a culture of support is to ensure that you do annual or every 2 years training on your policies. When you do this training, you want to have high level members of the organization that are in there showing support for these policies and emphasizing the importance that an employer cannot help an employee if they don't know about an issue. And so it's really important that employees feel empowered to speak up, and really getting out there and putting that message out to your employees is really important. The fourth component that is often overlooked is job description. So as an attorney, these are really helpful whenever there's any sort of dispute about what the essential qualifications of the job are. And so when we have down the line an employee that's seeking an accommodation, and they say, for example, I can't do X in my job. We're going to look back as your attorneys at the job description and say, well, is this an essential requirement of the job? If it was not communicated up front, it's going to be harder to establish that it was. I like having really detailed job descriptions too, in order to just make sure you and the employee are on the same page at the beginning of employment about what the expectations are. It's really easy to draft these and never look at them again and not adapt them as a job changes. So as a best practice, putting a calendar reminder in once a year, we're going to sit down and review our job descriptions. And that's going to be in connection with any performance review process, that we make sure that we're continuing to track what the job actually is with the job description. Next slide. So I'm going to talk primarily about the ADA today. That's the Americans with Disabilities Act, because it's a little more squishy and a lot more challenging for employers to know exactly what it involves. The FMLA has very specific guidelines about documentation and when things have to be responded to and notices that are provided. So it's just important to note that employees who have mental health challenges in the workplace may have what qualifies as a serious health condition. And if they're requesting time off work, they may be entitled to leave under the Family and Medical Leave Act. So just kind of note that when you're reviewing an issue and an employee comes forward. If they have not been with the organization long enough to qualify for FMLA, but maybe they're asking for time off, that shouldn't be the end of the question about whether or not they're entitled to leave. There may be leave under the ADA. So I think, one common mistake is employers may look initially just at the FMLA, say an employee is not qualified, and that's the end of the conversation. It's important to know that the next part of the process is then looking at the ADA. One place in particular that employers kind of often make a lot of mistakes is identifying when an accommodation may be needed. And we're going to talk a little bit more about that on the next slide. But what's important to note on my last point on this slide here is that if an employee requests FMLA and is denied, that may be enough to trigger a request for an accommodation under the ADA. Next slide, please. So the triggers for what's called the interactive process, which is just a process where the employer and the employee communicate really about what the employee needs to be able to perform their job to the best of their ability. An employee can request an accommodation. Someone can request an accommodation on an employee's behalf. So they can note that their coworker is struggling to perform their job because of a health condition and make you aware of that. Or the interactive process can be triggered where the accommodation is known. Next slide. So one of the tricky things that I think a lot of managers are uncomfortable with is if you recognize an employee struggling, how do you approach them? One of my favorite phrases here, it doesn't have to be overly legal. When you don't know what to say, the best thing to say to a coworker or an employee is, how can I help? And that can trigger a conversation about a potential ADA accommodation. If an employee tells a supervisor that they're, for example, taking anxiety medication and they're struggling to get work in on time, that can be enough to trigger the need to have this interactive process and discussion. Really, what you're looking for is an employee says, I'm having trouble doing X because of Y, and Y is any sort of potential disability, mental or physical. And we can talk about the definition of a disability under the ADA in a minute. If someone says they don't want a reasonable accommodation or they don't want to move forward in the interactive process, it's important for employers to respect that, but continue to remind employees that the accommodation process, that there's an accommodation policy, that they can move forward with it, and that the employer has an EAP if they need it. Next slide. So the steps in the interactive process, you're going to communicate with the employee. That's Just like Ruby's slide earlier, communicate, communicate, communicate. That's the most important thing about the ADA interactive process. In certain circumstances, you're going to request medical records to support the need for an accommodation. You want the healthcare provider to specifically tell you what their limitations are and how the healthcare provider thinks that they can be accommodated. Here are a few things you're going to consider in evaluating the reasonable accommodations, and then you're going to select an accommodation. Next slide. It's important to always respond promptly to the employee. Sometimes there's things going on behind the scenes where employers are talking about how they're going to accommodate an employee. Make sure that you keep them aware of how the process is moving, and also tell them what specific information is needed from their healthcare provider if you need information. The other thing that I will say is that the accommodation process is not over once an employer provides an accommodation. Employees' conditions may change from time to time, or the accommodation might not be effective. So continue to monitor that, communicate with the employee, ask them how things are going. Has this improved their ability to perform their job? And continue to evaluate things. Next slide. So here is the definition of a disability under the ADA. It's a physical or mental impairment that substantially limits one or more major life activities. The important thing to know here is that the definition of disability is really broad, so it can encompass a wide range of mental health conditions. If you as an employer are ever in a position where you're questioning whether or not an employee's communicated mental health condition constitutes a disability, you'll want to talk to an attorney about that. Really, in most cases, a lot of these conditions are going to be protected under the law. Next slide, please. Here's a list of possible accommodations. There's an infinite universe of accommodations that you may be able to provide to an employee that helps them do their job. You know, modifications to the work schedule, relocating to a quiet office space, job restructuring, reassignment, also unpaid leave in certain circumstances, and now remote work has become a much more common accommodation as well. Next slide, please. I just put this up here because this is a question we get a lot. If a job, if an employee's healthcare provider says that they need a low stress position where they don't have to multitask, employers want to know what their obligations are. So it's important to know that you never have to eliminate an essential function of a job as an accommodation, but we're going to look at, back to your job description, you know, is multitasking an essential function, or is it maybe a marginal one? And then also, you know, consider whether there are other accommodations. You don't have to offer the specific accommodation that an employee requests. There may be other ones that meet the same objective and maybe work a little better for the employer. Next slide, please. So be sure that the medical information is stored in a separate medical file. Don't disclose the employee's condition to the supervisor or coworkers. You're only going to disclose the actual accommodation on a need-to-know basis. Next slide. Sorry, I know we're a little short on time. Okay, so that kind of covers really what I wanted to talk about, a quick and dirty rundown of the Americans with Disabilities Act and accommodating employees in the workplace. It's a lot more complicated. There's also the FMLA to consider, but hopefully you got a little more of a big picture idea of the process and what it looks like.
Thank you, Kate, so much. It was a really informative presentation from you as well as all the other speakers. And at this time, I'll ask all the speakers to turn on their video and to unmute themselves for some Q&A. And we do have a couple questions in the Q&A box right now. And so there's a question that I'll merge it into one. It says, what do you do if you feel like you're a hamster on the wheel? And then how do you address that with your manager? And then Dr. Price, we can start with you.
So I think the hamster in the wheel comment came from my the element of burnout where people have lack of professional efficacy. And so it depends. So if you think you're burnout, the next step would be to understand why. And there are really 6 categories of most common causes of burnout. There is workload. So maybe there's too much work and you just don't have enough resources. So maybe that's why you're feeling like a hamster. Or maybe the control, that you're being micromanaged and you don't feel like you have enough influence, so you don't have really power to change your instance. So that could be why you're feeling like a hamster. Or there's lack of reward, so you're not getting paid enough or acknowledged, or don't have that internal satisfaction. Maybe you're burnout because you don't have a community. You feel like you're the only one working, you're isolated, and you feel like maybe there's some element of disrespect, or perhaps there's an issue of fairness, that you feel like there's some discrimination or favoritism in the organization. And then finally, if you have an issue with a conflict with your personal values and the values of the organization, all of those might be why you feel like a hamster. And so the first step would be to sort out which is more likely, and then addressing those particular issues.
Thank you. Ruby, as far as talking to your manager about it, do you have any advice you can share with the person who asked the question?
Yeah, I think, one of the first things that I encourage folks to do is to write out your thoughts, write out the things that you want to share with your manager, and then actually spend a few moments practicing that before the real meeting. Because what that allows you to do is remove some of your emotion from an emotionally charged conversation. So that's one of the main tips that I tell folks to do. Write it out, practice it before you have that conversation so that you're able to get some of those emotions out. And then when you have that conversation, really be listening, really think about how you can advocate for yourself, and then take time after that conversation to reflect on the conversation itself, and then jot down some action items to move the work forward or move your request forward, and then use that to follow up by email with your manager.
Wonderful advice. Thank you. This is a question for Kate. If we work for a company with less than 50 employees, what is the best way to accommodate employees with disabilities?
Yeah, so the 50 employee threshold is for the Family and Medical Leave Act. If you have less than 50 employees, you're probably not going to be covered by it, but you still are going to be covered by the Americans with Disabilities Act. And so if you have an employee that is, FMLA primarily provides unpaid leave. So if you have an employee that feels that they are not able to perform their job and they need time off, either to get treatment or just to reset and mentally recover, and they don't have PTO available, unpaid leave may be an accommodation under the ADA. So there may be circumstances where you do provide unpaid leave under the ADA.
Thank you. Another question for you. If you need to reduce or restructure the job responsibilities, can you also reduce the salary to align with the new job responsibilities?
Yeah, so one potential accommodation is moving somebody into a part-time role. They may say that, I can only work at 50%, and you can pay them commensurate with the number of hours that they're going to be working. So you could reduce. Another option is transferring an employee to a different position. So if you have a role that has different responsibilities, then that may be appropriate. What maybe isn't appropriate is if you're removing some marginal functions and as a penalty, you reduce their pay. That wouldn't make sense, but you really want to be consistent with really how you would treat any other employee who wanted to cut back on their hours for whatever reason that may be.
Thank you so much. We have time for about one more question if anyone from the audience would like to post it in the Q&A box. Not seeing any final thoughts you all would like to leave us with today? Dr. Price, we can start with you.
Sorry, took me a moment to get that unmute button. Really just to say, start small, that, it doesn't have to be that overnight you transform your culture to one of well-being, but it's important to just start. And I think if you what you'll find is your employees will respond to you and they'll want to help you with improving the well-being of the culture.
Thank you. Ruby?
I would say, tagging along with what Dr. Price mentioned, asking your employees, like, talk to them, ask them what they need to feel supported, instead of trying to guess what you think they need.
And Kate, let's end with you.
Sure. I would just say be really proactive about reviewing your policies and making sure they reflect your workplace, because if you haven't had one of these requests yet, you probably will, because it's becoming more common.
Thank you so much for all of the great wisdom you all shared with us today. And just thank you for the attendees for attending today's Educating Managers on Mental Health webinar. We hope you found today's content valuable. On your screen, you'll see a list of upcoming events, and we hope to see you at a future NC Chamber event. After today's webinar, we'll send you a brief survey in the recap email. And so we would appreciate any feedback you can provide to allow us to improve these sessions. And you'll also see that pop up as soon as you exit this webinar today. It takes less than a minute and it really helps us. So thank you so much for doing that. Again, the recording from today's webinar, as well as the slides, will be shared in the recap email. And thank you so much, and stay safe and healthy during this time. And we hope to see you again soon. Thank you, everyone.